The primary issue on this appeal is whether in a medical malpractice action arising out of a surgical procedure, a trial court may properly give the error in judgment charge absent a showing that a doctor has chosen one of two or more medically acceptable alternative treatments or techniques. We hold that the Supreme Court erred in giving the charge in this case, but that on the facts presented, the error was harmless. In 1994, defendant Dr. John Rogers, a vascular surgeon, performed an adrenalectomy on decedent Walter Ness. This surgery was the culmination of decedent's decade-long bout with renal cell carcinoma. Dr. Joseph Green, not a party to this action, first diagnosed the cancer in 1983. Shortly thereafter, in an attempt to contain the disease, Greco removed decedent's right kidney and adrenal gland. Unfortunately, the cancer persisted, and in 1991, a significant portion of decedent's right lung was removed. The cancer continued to metastasize, and in 1993, Greco discovered a large tumor on decedent's left adrenal gland. Interferon treatment proved unavailing, and the tumor grew to approximately 9 inches in length, 3 times the size of the adrenal gland itself. The growth was, in all respects, extraordinary. Greco recommended surgery to remove the mass, but decedent feared that the operation would result in the loss of his remaining kidney and ultimately force him to undergo dialysis. Nevertheless, decedent agreed that surgery would provide a better chance for survival, and Greco referred decedent to defendant. Defendant met with decedent and his wife and disclosed the risks inherent in such a procedure. Decedent signed a consent form. Defendant performed the left adrenalectomy on April 6, 1994, at Millard Fillmore Hospital. A number of factors increased the difficulty of this typically arduous procedure. At the time of the surgery, decedent weighed approximately 300 pounds. His size increased the depth of the surgical cavity and impaired the doctor's ability to see. The tumor was surrounded by an uncertain number of blood vessels and small arteries, all of which were a potential source of bleeding. Defendant controlled the bleeding by meticulously tying off or ligating bleeders and vessels as he encountered them. Additionally, the tumor organs and vessels were encased in layers of muscle and fatty tissue. Ultimately, defendant completed the surgery, removing the tumor in its entirety. Immediately following the surgery, decedent's urine output was noticeably abnormal. After performing a renal scan, defendant realized that he had inadvertently ligated decedent's renal artery, thus preventing blood flow in the kidney. Within hours of the adrenalectomy, defendant rushed decedent back to surgery, located the renal artery, and restored blood flow to the kidney. Despite the superficial success of both surgeries, the ligation caused irreparable harm to the plaintiff's remaining kidney. In 1995, decedent and his spouse, commenced this medical malpractice action against defendant and the hospital. Decedent died the following year of causes unrelated to the surgery, and his life was substituted as the sole plaintiff in this action. At trial, plaintiff argued that defendant negligently ligated the renal artery, thereby causing decedent's injury. Plaintiff's expert, Dr. Selwyn Z. Freed, opined that under no circumstances would ligation of the renal artery be considered medically acceptable, and therefore defendant breached his duty of care. Although Freed testified that ligation of smaller vessels may at times be unnecessary, at no point during the trial did plaintiff or her expert contest the professional validity of defendant's choice to ligate bleeders.
It's tough.